Med ethics is what the people have been asking to see, and the only reason I was hesitant to make a video about that is because I think there's a sort of misconception about how you should go about learning about medicine ethics for an interview. Ethics scenarios are oftentimes really complicated and multifaceted, so for me to pretend I could make an all-encompassing video on everything you need to know for med ethics would be disingenuous, I think. So rather I'll approach this as a series where we look at specific examples to start with, and real life scenarios and how they relate to that part of medical ethics. Because if I did try to make a video encompassing all of medical ethics, it would really just be me reading a list of keywords, which I'm pretty sure nobody wants to see. So I'll put a disclaimer up on screen about what I aim to do with this series. It's really just to put medical ethics terms into context so that you're better able to recognize them when it comes up in a question. And oftentimes I think there's a misconception about interviews being quizzes or something of that sort. You'll never really be directly asked to find justice. Rather, you'll be laid out with a multifaceted, quite complicated scenario, and it's your job to pick out which ethical framework or which topic within medical ethics this relates to. Anyways, in this video, we'll be looking at the 4 pillars of medical ethics and real scenarios for each one to help us build more context around these pillars, all whilst keeping in mind this is from the approach of a medical interview perspective. So firstly, what is ethics and what does ethics mean? Ethics is defined as the moral limitation placed on power, and medical ethics sort of came from the realization that healthcare professionals and people with power, skill, and knowledge to enact, treatment onto other people should have a moral obligation to help people and want to help people. And more specifically on med ethics, it's important to know that this should go beyond just not harming a patient, which we'll get onto, what that means in relation to the 4 pillars. But it should go beyond just not harming people. What the 4 pillars are is that they're sort of guiding principles that healthcare professionals can use to make decisions. And what the 4 pillars are autonomy, beneficence, non-maleficence, and justice. Starting off with autonomy, autonomy is defined as the right of adults with capacity to make informed decisions about their own healthcare. What this means, and specifically the capacity part, is that they're deemed to be able to understand, retain, weigh up, and make decisions about any information which a healthcare professional can provide to them. So the case study we'll look at for autonomy is Mrs. B versus an NHS hospital trust in 2002. Her name's redacted, so we'll refer to her as Mrs. B throughout this. Essentially, she had a history of spinal hemorrhages, one of which eventually left her paralyzed. But before being paralyzed by spinal hemorrhage, she'd wrote a living will which essentially stated in hers that if she were to ever be left with a severe disability from spinal hemorrhages, that she would want all life-sustaining treatment to be ceased. Unfortunately, her last spinal hemorrhage did leave her paralyzed, and she requested for her to be removed from a respirator. Despite having the living will and requesting to be removed from the ventilator, doctors within that trust decided that the living will was too vague, and they ultimately denied her from being removed from the ventilator. As you can imagine, Mrs. B wasn't very happy with this, so she went down the solicitor route, and over the course of 5 months, she was given multiple capacity assessments, passed them all. So now whether or not she was capable of making such a decision was out of the question. After being determined that she had capacity, the NHS Hospital Trust gave her 2 decisions. Either she could be slowly weaned from the respirator without painkillers, or she could be sent to a hospice, neither of which are what she wanted, which was just to be removed from the ventilator, assuming with painkillers. So after refusing this treatment, she took this to the EWHC, which is the English High Court of Justice or something like that. I don't know what that fully stands for. They deemed that her autonomy was being breached, and then ultimately she was transferred to a different hospital with doctors who hadn't been previously involved in her care, and then they took her off the respirator. So why is this a useful case to talk about? I think it's useful because ultimately her autonomy was breached. She was an adult with capacity who had her right to refuse treatment denied, which is a right that every adult in the UK with capacity has. They can deny any treatment they want. So we've established that autonomy was breached, but maybe we should talk about why this happened. And if you can identify this in a medical interview scenario, you can sort of give some charitability to doctors if they end up making mistakes like this, like breaching autonomy. And ultimately the reason why autonomy was probably breached is because doctors thought they were acting in her best interest. That's sort of the general consensus from this case. But that was still ruled to not be a sufficient reason to breach autonomy in this case. So what came of this was that the EWHC clarified that removing someone from life-sustaining treatment isn't the same as euthanasia or killing the patient. I'm not saying euthanasia is killing the patient, I'm saying either or. And they also clarified that death is caused from underlying conditions, not a doctor's action, which in the case of removing life-sustaining treatment, the death was caused by underlying conditions. There's not an active intervention like there would be with euthanasia. And it's probably quite important to state that last bit in your interview, because you managed to uphold patient autonomy and the integrity of healthcare professionals. Moving on to the next pillar of justice. Justice more so relates to the allocation of resources fairly, because in an ideal world, everyone could get the best treatment for everything provided by the NHS, but there always has to be a cost-benefit analysis, which was talked about in the last video where we talked about fluoride being added to water, why we need to approach situations with a bit more nuance when it comes to these things. And the case study we'll look at for justice is Jamie Brown versus the Cambridge Health Authority. So Jamie Brown was diagnosed with relapsed acute myeloid leukemia, which essentially means that there was a period of remission where treatment appeared to work with the acute myeloid leukemia, and then after that period of remission, symptoms started to show again, so now she would have to re-undergo treatment. The parents weighed in on the situation and wanted chemotherapy and a second bone marrow transplant, but consultants weren't really convinced that this would be effective, and they thought it would be too expensive for the benefit that would come out of it, or the potential benefit, because they were quite because they're more on the side that this wouldn't see any benefits really. The other two options were an American treatment at the time, and either going to Hammersmith for $75,000, which was also deemed too expensive for the slight possibility of it benefiting Jamie Brown in this instance. But ultimately the court ruled in favour of the health authority, stating that the NHS has finite resources, and for Jamie Brown's specific case, spending the resources which would have been spent on things like the second bone marrow transplant and chemotherapy would have probably seen not enough benefit. But ultimately what this case tells us is that even if there can be a slight benefit to treating someone, when the cost is too high and the benefit's too minimal, it's not unjust to refuse treatment. Moving on to the third pillar, and I should mention there's not actually a particular order to the pillars, I'm just doing this in whatever order. But beneficence is fostering the interests and happiness of other people and society at large. The case study we'll look at is from the Jodie and Marie twin case. So what happened was Jodie and Marie were co-joined twins, with Jodie having a functioning heart and lungs and could sustain her life by herself, whereas Mary was actually found to be dependent of Jodie due to, I believe it was sharing a major artery, which was mainly within Jodie's body. Now when it comes to these co-joined twins, there was two paths which you can go down. Either if you don't separate the twins, then they will both have an expected life expectancy of maybe a couple months after birth. However, if you went down the route of separating the twins, then Jodie could be expected to live a normal life, whereas Mary would die shortly after the separation due to her not having the functioning organs to sustain her own life. What was eventually determined by the parents was that they would refuse to undergo this separation surgery on the grounds of religious reasons. However, the court actually overruled this and said that this would have to be done in order to save Jodie as opposed to killing Mary. The reason why this relates to beneficence is because ultimately a life would have been saved through the separation surgery. Going back to the two routes which could have been taken, the one which maybe maximized benefit was the route of Jodie living an independent and full life, as opposed to both of them dying within a couple months. And that's more reductive than I'd like to word it. So to how I would approach this from a medical interview perspective is maybe state that harm, whilst tragic, sometimes is inevitable, and you have to take that into account when making decisions which benefit most people. Ultimately, this is a very complicated case, and it goes to show that sometimes every decision can have a really profound moral impact on the healthcare professionals involved. If that's another point you want to make in your interview about the impact on healthcare professionals when it comes to these decisions as part of being a healthcare professional. As for the last pillar, it's been a long video, so I'll keep this example simple. The last pillar is non-maleficence, which is refraining from harming another person. And the case study we'll look at is a patient who is presenting to have a viral disease, demanding antibiotics because they believe it can help them, whatever. The reason this relates to non-maleficence is because harm is prevented in two ways. First of all, if you're administering a drug which has no benefit, as antibiotics would to a patient with a viral disease, then they'll only have the side effects which would harm them. And the potential side effects of antibiotics would be things like diarrhea, allergic reactions, or drug interactions, all of which the patient who doesn't need antibiotics would be susceptible to with no benefit. Then in terms of how this harms wider society, there's the larger issue of antibiotic resistance. As more antibiotics are administered, antibiotic resistance goes up, which is obviously an issue to wider society because when people who do have bacterial illnesses try and take antibiotics, there's going to be a larger population of antibiotic resistant bacteria within them, which withstands these treatments, and then they're sicker for longer, basically. To summarize that video, it goes without saying again, even though I said it at the start, ethical scenarios are really multifaceted, and it's important to not get hung up on one thing when you're answering a question. Even with that example I just gave at the end about antibiotics and giving it to someone who doesn't need them, as well as relating to non-maleficence, you can also make the argument that relates to justice, because when you prescribe antibiotics to someone who doesn't need it, these things cost money, and it's not going to be a good use of resources, which is what justice revolves around. It's not going to be a good use of resources if you're giving people drugs who don't need them, antibiotics who don't need them. So to summarize, if I'm going to give one final piece of advice for med ethics entirely, is that it's multifaceted. Learn as much as you can and apply as much as you can of information that you think is relevant. This is a series, so this video was focused around medical ethics. Next video might be focused on, I don't know, any suggestions are welcome. But other than that, thank you for watching. If you want to do full med mock interviews, my email's in the description below. Get in contact. I make full, complete med mock interviews for every student I do one with. It's 40 minutes long, 20 minutes of feedback at the end, and then I email you back, all the feedback I'll give you.